Piles has 4 grades, grade 1 to grade 4. Now we will discuss the treatment mode for each grade. In early stage piles, that is grade 1, 2 and early 3 stage, we have the non-operative treatment of piles, which is sclerotherapy, banding and infrared coagulation. In advanced stage disease, that is late stage 3 or stage 4 disease, we have surgical options of stapled hemorrhoidectomy, the traditional surgery or laser hemorrhoidectomy. Infrared coagulation or IRC is a very effective newer treatment modality for early stage hemorrhoids, piles. Patients who don't have very severe disease or who don't want surgery are very effectively treated by this new gadget which we have, which has infrared rays in it. This is a simple technique. It's an OPD procedure. No anesthesia is required. No pre-op preparation is required. Patient comes to the OT for the procedure. In the position in which we examine the patient for hemorrhoids, I ask the patient to lie in that position. Through the proctoscope, we see the hemorrhoids, and this is the infrared coagulation gun. We introduce the gun through this proctoscope into the piles and just fire. This firing releases the infrared rays which coagulates the blood vessels in the piles, resulting in treatment or stoppage of bleeding in cases of hemorrhoids. This is a OPD procedure, no admission. Patient can go back to work the same day. Who are the patients who benefit most by IRC? Patients who have early stage disease means the frequency of bleeding is not that much, once or twice a month, or maybe once a week, but not much bleeding. Or patients who cannot undergo any form of surgery. Both this group of patients are very good and very nicely treated by infrared coagulation. Hemorrhoids band ligation. This is a technique which has been used for many years, but it has not been very successful. But now with the new equipment which we have, this technique has become much more useful and successful for early stage piles. This band ligation gun is attached to a low suction machine, a low pressure suction machine. What happens is when we see the piles and this gun is pointed in the piles, and this machine, when attached to a suction, it sucks in the piles, and then we fire the gun and the band which strangulates the piles and treat it. Because of this availability of low suction machine and this equipment, the same technology which we had in the past has become much more effective in patients who have single piles or early stage piles. Band ligation normally we do in early stage piles. Again, the patient does not need to be prepared for this surgery. He does not come empty stomach. No form of anesthesia is required. This is done in the examination room itself. After doing the procedure, in half an hour, patient is fit enough to go back to work. He does not need any rest. He does not need any post-operative dressings or any painkillers. Patients with advanced disease of piles who require surgery but are afraid of undergoing surgery can now undergo laser treatment for piles. This new advancement in piles and fistula is a very effective treatment. It does not require prolonged hospital stay. No post-op dressings are required. No bed rest is required. Patient comes in the morning, gets the procedure done under anesthesia and is fit enough to go back home the same day. He is back to work within a day or two. And along with that, it is very effective in advanced stage of hemorrhoids. Patients with advanced piles who require surgical treatment and cannot be managed by non-operative treatment like IRC or laser nowadays undergo stapled hemorrhoidectomy. In short form, we say it MIPH. This is the gold standard for hemorrhoid surgery in today's world. This stapler gun is used for the stapled surgery. It's a surgery in which all the piles are cut out. With this gun, when we do the surgery, there is no hand suturing or cutting required. This equipment per se cuts the piles and stitches the cut ends. This procedure is done under anesthesia. Patient needs to stay in the hospital for 1 day. As compared to the open surgery which we used to do in the past, the risk and the chances of complication are much less. Post-operative discomfort is significantly reduced when this procedure is used. stapled hemorrhoidectomy, if done properly, gives very, very good results for advanced stage of piles and is the preferred mode of treatment in people who have prolapsing piles, frequent bleeding, and who require immediate surgery for reduced hemoglobin.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.